Each month for many years, we've talked to Merritt Bates Thomas about the work and the mission of the Green River District Health Department, and has served so many people. Today we're going to walk through with Merritt the 4 primary services. Good day.
Good day.
I don't know how you distilled it down to 4 primary services over all of the programs, Merritt, we've talked about over the years, and all the counties you serve and all the people you serve.
Well, and there are 4 primary areas, but underneath those 4 primary areas, there are lots and lots of programs, and basically designed to meet the needs of a very diverse community. We covered the 7 counties: Davis, Hancock, Henderson, McLean, Ohio, Union, and Webster. And like other public health departments around the state, whether they're individual county departments or district health departments, they're organized very similarly to us.
Well, and they, I guess they're looking to you for the guidance and execution of a lot of those programs and the resources as well. So what are the 4 primary services we're talking about today?
So we're looking at clinic services, and we'll get back to those shortly. We have the public health protection programs, we have home visiting programs, and then we have my home base, the health education and promotion programs. And then there are actually, I didn't list them, but there's some others that don't fit into one of those 4 key areas because they're kind of outliers. They're outside the box, like our patient assistance program in 5 of our counties, which is a major contributor to meeting the needs of a lot of our residents having difficulty maybe finding services. Our CAP acts as a resource, but also in terms of just assistance with medications that may be too expensive.
So kind of help us have a picture here, if you can, of the need in those 7 counties for services like you just mentioned, patient assistance. And because I think if that's not on our radar, it's certainly on yours. What are we looking at?
Well, you're looking at people who need assistance securing those medications because they're cost prohibitive, and they could be cost prohibitive even with insurance coverage. So, looking to find a connection, if you will, through the Kentucky Patient Assistance Program that helps guide them to get the medicine as cost effectively as they can.
Because we hear that, certainly news stories are always about the pharmaceutical cost and who can't pay for them. So it's great to know that there's somebody they can turn to get that help. So for you, in the work that you do, what is there a the top priority in your mind of the services you provide, or is it just that whole big array?
It's the whole big array, and being mindful that, like I mentioned, it's a diverse community with unique needs. Through our clinic services, we touch young families coming in for WIC. Through our women's health services, we have exams that are offered, and preconception care, family planning services, disease investigation. Things like tuberculosis and sexually transmitted infections, surveillance around those exams, and then connecting with the proper treatment as well.
Well, we've got 30 seconds left, and the last thing on your document today was about get your vaccines up to date.
So it's back to school time.
Okay.
And we have a Kentucky Immunizations Registry. And you can simply go online, Google search Kentucky Immunization Registry, go into the portal, load in the information, whether you're a parent looking for your child, and enter in date of birth. They'll send you a secure way, a verification code to enter in, and you can get that up-to-date information about what your status is. I used it yesterday. I'm up to date.
All right. For grown-ups and for little ones, thank you, Merritt.
Thank you.
We'll be back with Ron's weather right after this. Stay tuned.